Israeli healthcare workers who were boosted with a fourth shot of COVID-19 vaccine at the height of the Omicron wave were only marginally more protected against reinfection than their peers who had received 3 jabs of vaccine, researchers reported Wednesday. Compared to getting 2 initial doses and 1 booster shot of Pfizer and BioNTech's Comirnaty vaccine, adding a second booster shot reduced the rate of coronavirus infection by just 30%. The fourth dose was somewhat more effective at preventing COVID-19 symptoms, according to a study published in the New England Journal of Medicine. The healthcare workers who got the second booster shot were 43% less likely to show signs of illness than were those who hadn't. Using Spikevax, Moderna's COVID-19 vaccine, as the second booster shot was even less effective at preventing coronavirus infections in this group of younger, generally healthy Israelis. Recipients were only 11% less likely than those who had gotten 3 doses of vaccine to be reinfected during Israel's Omicron wave, and they were 31% less likely to suffer symptoms of COVID-19. The benefits of a second booster shot were small to begin with, but they were even smaller in light of how effectively 3 doses of vaccine had reduced the impact of a coronavirus infection to a mere nuisance. Whether they had had 3 or 4 doses of COVID-19 vaccine, most of the Israeli doctors and nurses who took part in the new study and then became infected reported negligible symptoms, the study authors noted. That means the practical benefits of a fourth dose would scarcely have been noticeable in the study's population of 821 people. The researchers also observed that those who got a fourth dose and subsequently became infected had relatively high viral loads. That suggests that the added booster had done little to curb their ability to transmit the virus to others. A fourth vaccination of healthy young healthcare workers may have only marginal benefits, the Israeli researchers concluded. The extra shot reliably boosted coronavirus antibodies, but the protective value of the mRNA vaccines appears to have been achieved by 3 doses, they added. The newly published study comes a day after Pfizer asked the Food and Drug Administration to authorize a second booster shot for Americans 65 and older. In doing so, Pfizer cited the results of 2 unpublished Israeli studies,